Good afternoon, everybody. My name's Scott McGann with the Falmouth Health Department, doing a weekly COVID-19 update for April 15th, 2022. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. There was 49 cases this week. Actually, that should be April 14th, it's ending the period of April 14th. 4208. I accidentally put 4054 last week. It should have been 4154. It's kind of threw me off for a few minutes when I was doing this. So we had 49 confirmed cases for the week, 11 probables, which is definitely an increase than what we've had previously. It's happening also throughout the state, throughout everywhere, locally as well. We'll talk about that in a minute. Obviously, that's going to increase our incidence rate, which is 12.6 per 100,000 as a daily incidence rate, which was previously 8.90, and that's our incidence rate. And our positivity will jump also as a result from 2.68 to 3.24. And remember, these are PCR. The probable ones are not the rapid. The 11, that's going to Convenient MD or CVS and getting a rapid. And the number here for the 49 is PCR testing, not home tests. So there's always going to be a certain percentage higher for the home test of what is actually going on. So our case counts, you can see in the far right, have jumped. Obviously, it's been jumping pretty much throughout the state. We'll talk about that in a second. And this will start ticking up a little bit as well as the case counts go up. But getting into this 2,962 for yesterday's reporting, that's almost double roughly what the number was that when I did this last week. I think it was right around 1,600. Positivity has definitely jumped up as well. It was below 2 at one point over a few weeks ago. It's at 3.66. But you notice on the far right, the deaths are not jumping. And hospitalizations really aren't jumping quite as much either. So when you go down to the trends, you see the the blue and the green showing that uptick, the blue being cases, and then cross, and then you see positivity, you see that going up, but you don't see that in purple with the deaths. You see a little bit with hospitalization, but you see it, not seeing it with deaths because, we're at a different point in the pandemic than we were a couple of years ago when it comes to that. Our incidence rate, again, is middle to high. We're kind of bunched up in here with a lot of other towns at 12.6, with the state average being 18.7 for that same time frame. Positivity 2.93, us at 3.24, slightly higher than the state, somewhere in the middle for our neighbors here in Barnstable County. So again, what does that mean for our transmission level? It's considered low. Again, it'd be fewer than 200 cases per 100,000. Okay, keep everything equal amongst counties. You give everybody the same population, and then COVID admissions per 100,000 is less than 10 in a 7-day total, and inpatient beds less than 10% being eaten up by COVID-19 patients. So this week's number is 102.82, which is 45% higher. It was 56, I think, somewhere around that last week. So you see the increase in cases, still not over that, because if any one of these categories click up, we'd go over to medium. There are a couple counties, I think it's Middlesex, that looked like it was yellow this week. COVID admissions per 100,000 was still about half, but it's 24% higher than last week. It was 3.8, somewhere in that range. And inpatient beds only went up by 8. So you're not seeing the hospitalization sort of still well below 10% at 1.3. Again, we're getting more cases. The cases generally are not resulting in the severity. This chart takes into consideration the severity by hospitalizations, people that are in the hospital. And this data is good from the 13th. So Barnstable County remains in the low category, but going up. Cases, again, these numbers go up a little bit, but it's still right around 1.5% below 2% of hospitalizations among those people that get COVID and have been vaccinated. And under 1%, still 0.47. Pretty stable numbers week to week. So 0.47% of all vaccinated people that have had a breakthrough case have died as a result of it. And as far as the entire population, everybody who's been vaccinated, whether they've gotten COVID or not, the death has been 0.04% and 0.15% hospitalization among everybody who's been vaccinated, and breakthrough has been at a rate of 8.8%. So they're pretty stable numbers from week to week. Second booster doses, again, anyone 50 or older may get a second booster dose at least 4 months after their first booster, okay? So you can get a second booster 4 months. 18 and older with certain medical conditions and 12 and over with other certain medical conditions can also get it within 4 months of their first booster, this would be your fourth shot with an mRNA such as Pfizer or Moderna, or it would be your third shot if you had had J&J as your primary vaccine. And you can mix and match. Okay, so that's still there. Now, as far as the vaccine itself, I went on there today. There's Nurse Kathy and she went on there for me today, and there's plenty of open slots. I think there was, we looked at 3 or 4 different places, and over the next couple of weeks, there was like 70-something open slots. So that there's still plenty of open slots, so we're not going to run a clinic if there's plenty of spots locally. Again, the vaxfinder.mass.gov will get you to the pharmacies, convenient MD, whatever. Barnstable County, the office, not really doing a lot right now. They did have someone leave, but just going on VaxFinder, any of the county, any 4Cs, anything that's going to go happen, it all gets to the clearinghouse for vaxfinder.ma.gov. The homebound, again, call the health department. We'll have the VNA come right out. Same cast of characters doing testing for the most part. It's convenient MD and the pharmacies. And it's the Falmouth Hospital, and some of the community health centers will do it as well. Barnstable County Health is not doing any right now. We've just closed as opposed to closing. We're really not doing anything because of the lack of interest in it. And home kits are taking over a lot of this. And again, home kits do not show up in our numbers. So when our numbers go up with PCR and go up with the rapids done at the convenient MDs of the world and the pharmacies, the home kits are some percentage higher. And so when those cases go up, just assume there's a lot more COVID through home kits, and that number is just going up proportionally. So that's where we are with that. This I did not fill out. This is still of last week. I just didn't get a chance to fill it out. We've been making small gains. I did not get a chance to fill this out for today. I just got back in to work. I will update this on our website to get you a more accurate number. But we've been gaining, like I said, this is for the previous week. This is 143. I'll update this chart and put it online. But I'm sure we get somewhere between 75 and 180, somewhere in that week. These usually are typical week. Again, Omicron, the newest variant, the BA2 is the primary one. The previous Omicron is in purple, and Delta was in orange, and that's a long time ago. There was a blip where they had some on March 26th, so it's not like it's completely eradicated, but more recently now, we definitely mostly BA2 is the majority of our cases. No mitigation at this point. We're still in the green. The state hasn't done anything different. So other than advising residents to wear masks in town-owned properties, that's what the selectmen still had the advisory for. There's no requirements or any mitigation at this point in time. Again, case counts are definitely increasing like everybody else around us, but we do still remain at CDC green based on the burden. The burden, I say, is for our hospitalizations. There's plenty of vaccine and testing capability. If you're interested in a second booster 4 months after your last booster for 50 and older, or those that are less than 50 with the comorbidities that you can find online, just type it in the CDC or the state's website. No mask mandates or advisory in town, but again, except for the advisory I just previously mentioned, but consider, your masks wearing and and your actions based on your individual circumstances. So that's what we have for an update this week. And again, plan on doing one again next week. And everybody have a good one. Thanks.